and gentlemen, we're truly honoured to welcome you to the launch today of Europe's Beating Cancer Plan, a plan that is presented in the middle of an unprecedented COVID-19 pandemic, but a plan that also gives us hope, I believe, for the future for so many cancer patients and their families and citizens and European citizens. And as Vice President Hinas has said, it was exactly 1 year ago when we stood together beginning the journey in the European Parliament, shoulder to shoulder with cancer patients, with scientists, with medical professionals, with partners, together with President von der Leyen, Vice President Hinas and members of the European Parliament. And we took the first step then towards a new EU approach in cancer prevention, in diagnosis, treatment, and, of course, care. And today, after 12 months of listening, of consultation, and I would say of learning as well, we mark another important step in this journey. If I may be allowed to share with you a journey which, for myself, is very much making the personal experience political, because we are all aware that in so many member states there is a lack of information, there is inequality of access, there is stigma and fear associated with this disease or with the word cancer alone. And for us it is important that we needed to do more and we needed to do different. We are truly privileged to be here with Vice President Hinas and to be in a position to bring forward a plan that we hope will have an impact on the life of so many Europeans. This year finds us in the middle of the pandemic, and of course this has impacted greatly on the lives of cancer patients. 2.7 million people are diagnosed with cancer in the EU, while another 1.3 million of Europeans lost their lives. And throughout this pandemic, and speaking with stakeholders and patient organizations, so many cancer patients have not had access to their treatments in time, and so many citizens have not accessed screening programs. And this had as a result the decrease in the number of cancer diagnoses, which is in itself a very worrying situation. And we need to be very clear here that unless we take very clear and urgent and decisive steps and actions, more and more Europeans will be losing their lives to cancer. And more lives will be turned upside down because every time you have a cancer diagnosis, the whole environment, the family face the same sort of pain and fear. And I always say that having a cancer diagnosis has the same ripple effect as throwing a stone in a lake, and you see the lake, the ripples of the water going outwards, and this is what it's like. The patient may be in the middle, but everybody around them is affected by this. And we're here to try and bring about change. So with the launch of Europe's Beating Cancer Plan, we want to make a difference to this in the future and to have an impact on cancer care in the coming years in Europe. It prioritizes the well-being of patients, their families, of our citizens. And this plan is about hope, it is about resilience, and it is about action. In this plan, we aim to prevent the preventable. We must remember that 40% of all cancer cases are avoidable, so we will be addressing key risk factors, not only smoking and harmful alcohol consumption, but obesity, diet, the lack of physical activity we see nowadays, exposure to pollution or carcinogen substances and infections. We aim to eliminate cancers caused by the human papillomaviruses, and we're proposing support for member states on vaccinations, with an aim to vaccinate at least 90% of a target population of boys and girls by 2030. And this is real prevention. We will create a tobacco-free generation with less than 5% of the population using tobacco by 2040, compared to around 25% today. And we will be looking at promoting healthier diets by reducing carcinogenic contaminants in food and nutrition labelling, marketing of unhealthy food products. And we are proposing mandatory labelling of ingredients and nutrient content and health warnings on alcoholic beverages. we often hear the phrase, early detection saves lives. And it sometimes just becomes a phrase, but this is science, and we know that early detection through screening give the best chances to beat cancer and to save lives. So we'll take action to screen more, but not only to screen more, because it's not about screening more, it's about screening better. It's about screening according to scientific optimal guidelines. We will be ensuring that screening programs are up to date based on the latest scientific evidence, and we will consider extending targeted screening also to other groups, such as prostate, lung and gastric cancer, depending on the science always. So our actions are aimed to raise the quality of cancer care. By 2025, we will be establishing a network linking recognized natural comprehensive cancer centres in every member state to improve access to high-quality diagnosis of care. Every patient has the right to be treated in a comprehensive cancer centre by a multidisciplinary team. This is the time when we need to bring all this together. And we will need to do this, we will also need a workforce that can deliver. So this year, we will be launching an interspeciality cancer training programme to address skill gaps and support cross-border training. So, ladies and gentlemen, the number of those who have survived cancer is growing every year, and this is hope. And now we estimate that there's over 12 million people in Europe who have survived cancer, and we need to prioritise their well-being, and we address this in this plan. Because survival is in itself vital, but they also need to live well. All cancer patients, all patients after surviving and going through any disease need to live long but live well, free from discrimination and free from unfair obstacles. And this is also in the plan that we are presenting to you today. By 2023, we will launch the Better Life for Cancer Patients initiative, focusing on the follow-up care. We will look at the return to work, at social integration and practices in the financial sector that can lead to unfairness on health grounds. We will be having a cancer survivor smart card tailored separately for adults and for children. We want to ensure that all cancer patients have the same chance of survival and access to care no matter where they live in the EU. And it is I would say the word unacceptable that today we have different access to prevention programs across the EU, different rates for early diagnosis, early detection, treatment, and of course survival. And we need to have a European Union that represents all its citizens equally. We'll be launching a cancer inequalities registry to identify the differences between member states and regions by 2022 so we can better direct our support. And we will be shining a different spotlight. We'll be shining a spotlight on childhood cancer. We need to address the different diagnostic, therapeutic, survivorship and psychosocial needs of those children and adolescents who have been through cancer and their families. And this is important. This is a group of children and adolescents that do have different needs. And we need to look at these needs and also their access to innovative treatments. For this reason, this year we will launch the Helping Children with Cancer initiative to ensure that children have access to rapid and optimal detection, diagnosis, treatment and care. So EU citizens deserve to live in a society that protects them from avoidable cancers, but that also ensures early detection. A society that provides equitable, affordable, high quality and sustainable care to those who need it, regardless of where they live in the European Union. And the Europe's Beating Cancer Plan that Vice President Schinas and I are presenting to you today is our ambitious, it's our concrete and our collective response to this demand. It's not a guaranteed solution, but it reflects a strong political commitment by the Commission to leave no stone unturned in our efforts against cancer. And its success can only come out of genuine partnership and genuine collaboration. So I look forward in the coming months and onwards to discussions with member states, with the Parliament, with cancer advocates, with the scientific community, with all stakeholders, to make this a reality. And I will be asking them what we are asking of you today, to join us on this journey, to walk this path, and to help us turn this concrete ambition into very concrete action.
Thank you, Commissioner. Do you want to say a word about the video, which we'll be showing at the end of the press conference?
Yes, we are in strange times, but we felt with Vice President Schinas that we wanted to share this with you. Last year, as Vice President Schinas said, we were in the European Parliament. And for any of you who were there, you may have remembered a very inspiring group of women, the CEO of Change Choir from Ireland. And we had then discussed with them the possibility that 1 year later, if we were presenting the cancer plan, that they would join us again. They have been unable, of course, to be here because of COVID-19. But these women who truly, they inspire me and they move me, put forward a video with all the messages that they felt the plan represents to them. It's a video of hope and inspiration that they managed to do despite being in lockdown, which shows their determination. And we felt that we wanted to share this video with you. It will be after the Q&A for those of you who have, of course, the time and want to watch it. But for ourselves, their message in this video is that we can make things better. And I think that this is what it's about. And this is what these women teach us, that no matter how hard, no matter how tough days are, and days are so tough for each and every one of us in the COVID-19, we need to continue fighting. We need to continue to look forward, and we need to continue to try and make things better. So it's very much in the spirit of Europe's Beating Cancer Plan. Thank you.
Thank you very much.